Congratulations on your pregnancy. On behalf of all of the providers in Premier Women's Care, we would like to thank you for entrusting us to provide you with knowledgeable and compassionate care during a pivotal time in your life. We hope that you will find the information in this video not only beneficial, but educational, whether you are a first-time parent or continuing to build your family. Now that you have completed your confirmation of pregnancy appointment, you are ready for the next step in care. First, you will meet with a financial counselor who specializes in pregnancy billing. Your next appointment will be your longer new OB appointment, in which an OB coordinator or certified nurse midwife will obtain your health history and your past obstetrical history and your family history. You will then have an examination done by your provider or midwife. The purpose of this video is to assist you in understanding of the information you will be asked to provide during this new OB appointment. We will also be able to provide you with information on how to access educational materials, as well as describe medications, labs, and specialty testing that may be done during your pregnancy. Part of the preparation is an understanding of the obstetrical consents that you will need to review and sign prior to your initial OB appointment. The first consent that you will review and sign is a receipt of notice to obstetric patient, in which you will confirm your knowledge that you have received a Florida Birth-Related Neurological Injury Compensation Act, or NICA, brochure. This brochure will be given to you at your in-person new OB appointment with your provider. This brochure is pursuant to Section 766.316 of the Florida statutes. This educational brochure is provided to notify you that Premier Women's Care does participate in NICA, which is only one of 2 such programs in the nation. NICA is devoted to managing a fund that provides compensation to parents whose child may suffer a qualifying birth-related neurologic injury. The next consent you will review and sign is the OB Patient General Agreement and Lab Testing Consent. While there is a great deal that your provider can do, you must be an active participant in your OB care to make this the best experience it can be. Therefore, this document outlines a few things we will be asking of you to optimize your care and the care of your baby during your pregnancy. This consent also includes information regarding prenatal laboratory testing. Premier Women's Care of Southwest Florida performs routine prenatal laboratory testing on each patient during their prenatal care. These tests are screens to provide each patient with the standard of care necessary for an optimum outcome for their pregnancy. These labs have been determined to be important as the factors associated with these labs have been associated with adverse effects on the fetus if not identified early in pregnancy and treated appropriately. These laboratory tests are not included in the obstetrical global fee and will be billed separately to your insurance carrier or to you if self-pay. If you are joining our practice later in your pregnancy, you have an individual factor that deems further testing available, some labs may be ordered and drawn as determined by your provider. The next consent you will review and sign is regarding pregnancy screening for chromosomal abnormalities. Premier Women's Care offers screening tests to assist in identifying babies at risk for Down syndrome and other chromosomal abnormalities. Chromosomal testing is often referred to NIPT, or non-invasive prenatal testing, which means this is a blood specimen and not an invasive procedure that would affect the pregnancy directly, such as amniocentesis. These tests have a detection rate for Down syndrome of up to 92% and a lower false positive rate than in previously offered tests. 50% of all children diagnosed with Down syndrome are not detected on ultrasound imaging alone. These tests have a detection rate for Down syndrome of up to 92% and a lower false positive rate than in previously offered tests. 50% of all children diagnosed with Down syndrome are not detected in ultrasound imaging alone. The testing offered is a determined risk, not to make an actual diagnosis, as these are screening tools. Additional invasive testing will be needed to determine an actual diagnosis if abnormalities are detected in screening tests, such as NIPT testing. A second test is completed when chromosomal testing is elected that screens for open neural tube defects such as spina bifida. These tests are optional and not mandatory. Your provider should have given you a pamphlet on Florida Women Care Laboratory, as well as this pamphlet can be found on PwC under Confirmation of Pregnancy and First Trimester Education. Please see the section on the FWC NIPT pamphlet in which you are to call FWC to initiate your prior authorization if you are interested in NIPT. This should be completed prior to your new OB appointment so that you will know any out-of-pocket costs that you may have. Please do not call your insurance company regarding this cost, as FWC will assist you in the out-of-pocket cost determination for this testing. Please note that NIPT is the only test we offer that also determines the gender, with the exception of ultrasound. Again, these tests are not mandatory. However, they are recommended in pregnancy to determine risk. If you decide on NIPT testing, an additional consent will be required for this. The next consent you will review and sign is carrier screening for inherited birth defects. Carrier screening is a type of genetic testing that can tell you whether you carry a gene for genetic disorders. If you are not a carrier for any of the recessive disorders listed, we will not need to test the father of the baby. If you are a carrier of any of those listed disorders, we recommend the father of the baby also be tested. These genes are recessive, meaning both mother and father must carry the same gene to have an affected baby. Being a carrier does not mean you have the disease and only means you carry the disease. If both you and the father of the baby are carriers of this same disease, it is a 25% chance your child may be affected, or 1 in 4. All women who are thinking about getting pregnant or who are already pregnant are offered carrier screening. You do not need to have a family history in order to be a carrier. Currently, our practice offers screening for 14 recessive genes. Ultimately, the goal of genetic screening is to provide individuals with meaningful information to guide pregnancy planning based on their personal values. The American College of OBGYNs, or ACOG, recommends carrier screening for all pregnant women. It is up to you whether you pursue it. Our premier women's care website at www.pwcswfl.com is filled with specific attention to patient resources and is a tool for patients to use during their pregnancy to provide information that will be helpful to you during your pregnancy. We ask that you devote a small amount of time to review the information on the website, as well as check back from time to time for any updates that may be added for your review. Under the General section, please review the medication list that is approved for limited safe use in pregnancy. Please review the 5-page document in the General section, Frequently Asked Questions in Pregnancy, handout that you will find most useful in answering most questions that you may have in your pregnancy, such as can you travel or how many ultrasounds will you have in your pregnancy. Our first, second, and third trimester education sections are informative in regard to each trimester and the expectation of these specific times in your pregnancy. We ask that you review each section and familiarize yourself with each area as you may make a mental note for future use. The last section of the Obstetric Resource webpage covers forms in which there is a dental guidelines in pregnancy letter, what you can print and take with you to your future dental appointments while pregnant to let your dentist know what can be performed in dentistry in pregnancy as well as antibiotics to avoid. Please note that our providers deliver at Cape Coral and Health Park hospitals. We do recommend that you research the obstetric section of the hospital website as they have important information for you to review, such as breastfeeding classes, birthing classes, infant CPR, expectations regarding delivery, and even a virtual as well as in-person tour of each hospital. You can pre-register online for the delivery through MyChart electronically with Lee Health, or you can print the pre-registration form under our forms section and mail or hand deliver this form around 30 weeks of pregnancy to the hospital. At this specific time, we would like you to have chosen a pediatrician that you prefer so this can be added to your chart for delivery. These resources can be saved or printed and are also available on our website. We hope that you find this information useful, and if at any time you have any questions, we encourage you to ask, as we want to make this process for you as seamless as possible. Thank you for trusting us with your care.